Hey, this is Jay Dela Cruz. I'm a second year nursing student, and later on this video, I'll be performing perineal flushing and female catheterization. But first, I'll be performing immediate newborn care. So this pertains to the care that is given to the newborns right after birth to check for the baby's condition or to check for any problems that might need urgent treatment. So following any procedure, I'll be performing hand washing to prevent cross-contamination, and I'll prepare my materials and ensure its completeness so I won't find myself looking for them later. In the delivery room, I'll have to identify the infant through their name bands for correct patient identification, and I'll have to perform another hand hygiene procedure to ensure preventive measures from cross-contamination. Then, I'll be wearing my working gloves to protect myself from fluids. And then after that, I'll have to ensure the infant's comfort by keeping the environment warm so they can conserve their energy, since newborns may not yet be able to use their energy to keep their bodies warm. And to do this, I'll be using my drop light with a warming function. Then I'll weigh the baby for documentation, and should the baby fail to meet the normal weight, it may reflect problems with the baby's health. So this information is a crucial part in the diagnosis. Now, I'll proceed to dressing the baby's cord, and it's important to do this to help prevent infection. So, to do this, the area should be sterile, and I have to remove my working gloves. And then again, decontaminate my hands with alcohol before I don my sterile gloves. So, this will be my right hand glove and my left hand glove. Glove my dominant hand first, and then insert my right hand glove to wear my non-dominant glove hand. Then I'll discard this. So the baby would be moving, so I'll be restraining their limbs with a closed diaper for infants. So I have here a closed diaper. It's already pre-folded. I'll just cover up their limbs, their arms, their legs. And then, using cotton balls soaked in alcohol, I'll be disinfecting the cord from base upward. I should use every corner of this cotton ball, and keep in mind that I don't have to retrace a step, right? Then discard the cotton ball. I'll be placing a sterile gauze pad at the base of the cord. And clamp the cord with an umbilical clip, half-inch from the base of the cord, so right about here. So right about 5 centimeters from the cord clip, I'll be cutting the cord and express the remaining blood. 5 centimeters. And using my sterile gauze pad, I'll be expressing the remaining blood at the tip of the cord. Then using another sterile gauze pad, I'll be placing it at the stump, cord stump. And I'll start pouring 70% ROH or alcohol over the cord. And then I'll doff my sterile gloves and discard the receptacle. For vitamin K injection, I'll be withdrawing my vitamin K from the container with my syringe. Pull out the medication and inject this into the middle third lateral aspect of the infant's thigh. So, here. Advance the needle and push out the medication. So supplementing low levels of vitamin K at birth is recommended since vitamin K deficiency can lead to dangerous bleeding for newborn and infants. And after that, my syringe should be discarded in needle receptacle. So another important clinical tool for diagnosis, aside from the weight of the baby that I took earlier, is their anthropometric measurements. So to do this, I'll be needing my measuring tape that I pre-cleaned earlier to measure starting from the head circumference. Then their chest circumference. Next would be their abdominal circumference. And lastly, the total length of the newborn. So aside from the infant's weight and measurements, another important clinical tool for diagnosis is their temperature. So I'll be taking it rectally using my thermometer. I'll be inserting the thermometer into their rectum, which gives us some more accurate reading of the infant's core temperature. Then I'll be taking other vital signs as well, starting from the baby's respiration while checking for breaths per minute and also their heart rate. So in checking their heart rate, I will be locating their arm and elbows. I'll be feeling the pulse right between them and count for a full minute. So the baby's pulse is usually 100 to 150 beats per minute. Newborns are delicate, so is their skin. So proper skin care and bathing is recommended after 2 to 4 hours after birth. So to do this, I have to hold the infant in a football grip manner while folding both ears so water won't clog inside their ears. And I'll be using a mild soap or shampoo to wash and dry right after. Then I'll be wrapping the newborn with a clean blanket to keep them warm. The next, I'll be clothing the infant with infant's clothes. I have here a bonnet, to protect the head side of the baby. Next would be the socks to protect the foot of the baby. I'll be doing the same thing on the right leg. I also have baby mittens to protect and warm their hands. And also on the right hand. Right, and then I'll be covering the baby with the blanket to restrain also their limbs. To add warmth to the infant, I'll be placing them in their crib with drop light and attach their crib tag with their information. So since the newborn is under the light for doing increased prophylaxis, I'll be shading both eyes from the light. So increased prophylaxis is a practice of washing a newborn's eye with 2% silver nitrate solution to protect against neonatal conjunctivitis. So by gently opening the eye one at a time, I'll apply ophthalmic ointment from inner to outer canthus while making sure that the tip of the medicine will not touch the eye of the newborn. Then I'll be doing the same thing on the other side as well, from inner to outer canthus. After the procedure, I'll be doing my personal aftercare of the materials that I've used and perform hand washing for my own personal hygiene and to prevent cross-contamination. Then, I'll mark the procedure done and document other important data. So that's it for my immediate newborn care. So this time, I'll be performing perineal flushing, or the care that involves washing the genital and rectal areas of the body. So before the procedure, I'll prepare all the necessary materials and ensure the completeness. Then I'll proceed to washing my hands to prevent cross-contamination, then start by explaining the procedure to the client. So, hi, my name is Carl. I am a student here. So, may I know your full name, please? When is your birthday? So, how old are you? So, how do you want to call you? Alright, so Ms. Sotoro, I'll be with you for your perineal care. This is important because the perineum area is one of the areas in your body that is at higher risk to infection, since it is more conductive to pathogenic organisms due to warmth, moisture, and poor ventilation. And by properly taking care of our perineum, we can prevent infections, unwanted odor, and irritations. So please keep yourself comfortable. I'll be providing you with privacy by closing the curtains. And I already ensure that the door is locked, so anyone from outside this room won't be able to see you. So I'll just be donning my gloves, so I'll be with you for a while. So before donning my working gloves, I'll be performing hand hygiene. So now I will be assisting you to a dorsal recumbent position, lying flat and supine with your knees slightly bent will give you comfort during the procedure and a space for me to clean the whole area. Now we'll also insert a waterproof pad right here. Right, so can you turn to your side? Then the other side. So the waterproof pad will protect the linen from moisture and the water that might splash on it later. And will prevent soiling the bed sheet and wetting it. Alright, so I will also place the bedpan underneath. Right, I will be placing it now. Okay. Alright, so Ms. Sotoro, I really hope you can be comfortable with me doing this type of care, and for additional privacy, I'll be draping the parts that I won't be working on them. So you can get the minimum exposure to lessen discomfort, and it will also act as a blanket to provide warmth. So I already prepared a pitcher with warm water inside. It has to be warm to avoid shocking you with sudden changes in temperature. And it will also promote blood flow. So next I will be needing my cotton balls, which I pre-soaked in antiseptic solution, and keep my kidney basin at a close distance to act as a receptacle for the used cotton balls right after. Alright, so Sapporo, this time I really have to lift the drapes. So can I do it now? With my forceps, I'll pick up one cotton ball with and cleanse the midline. This cotton ball has an antiseptic solution. I'll be cleansing from the midline of symphysis pubis down to the anus. So while keeping in mind to wipe in a single direction and not retrace a stroke, this is because when the cotton balls pass one area, I have to consider it as a contaminated already, and I will be needing another set of cotton balls. So this one is contaminated already. I will be discarding it in our kidney basin. Now with my second cotton ball, I will be cleaning from the mons pubis in a manner that resembles the number 7 through the external labium towards the anus, and then I will be discarding the cotton. One stroke, and then discard, and then with my next cotton ball, I'll be doing the same thing as the previous one, but from the opposite side. So I'll be doing the opposite of 7, and keeping in mind one stroke, and then discard the cotton ball. Then I'll repeat the 2 previous steps by doing the wiping in the same manner. It is important that to repeat those steps, as the area around this part is most likely going to be more soiled than the rest. And on the other side as well. One stroke. Then I'll take another cotton ball to clean the groin, going upwards towards the thigh. I'm going towards the thigh, then switch the side of the cotton ball for the other side. Alright, so discard the cotton ball. So I'll take my warm water this time, and then flush the perineum thorough. Right. So now that I'm, aside from preparing soaked cotton balls, I've also prepared dry ones to dry the moisture from the flushes earlier. So I'll be wiping the perineum area now. I'll be drying it in the same manner that I did with the previous steps. This step is important since moisture could support the growth of pathogenic organisms. So let's start again doing the same procedure as earlier, but this time with dry cotton balls. Alright, so now that I'm done, I'll be removing the bedpan and turn the patient to the side so I will be able to clean the buttocks area. Alright, so this time I'll be cleaning the buttocks one side at a time. So I'll use one cotton ball to wipe one side and avoid retracing in the same area. So Ms. Sakura, I would like to ask you to turn to your side. Then I'll take one cotton ball with antiseptic solution, and then I'll do a wipe from front to back without retracing the same line, and moving from another side of the cotton ball. Alright, so discard the cotton ball, and I'll take another one, and do the same thing on the other side. From front to back. And then discard the cotton ball. Then, this time I'll take one dry cotton ball to dry the buttocks. So, I'll dry them with the same reason of preventing moisture buildup. I will also using dry cotton balls to dry. The same manner that I did with the antiseptic solution. this cord. Take another dry cotton ball to do the other side. In the same manner that I did with the antiseptic solution cotton ball. Right, and then this cord. Okay, so I'll be assisting you to comfortable position now. Okay, so Ms. Aparo, I hope you're still feeling comfortable with me. Now that you're lying on your back again, I want you to bend your knees just like earlier, alright? So this time, if necessary, I would be spraying the perineum area with antiseptic spray to further promote healing, and with their antiseptic properties, it will also help reduce the risk of skin infections. Right, so we're almost done. I will be taking a perineal pad and place on your perineum in an upward motion. So from the anus area towards the menorah. So perineal pads will relieve you with your pain, especially cold ones, but it is mostly used to cover a wound or to absorb menstrual period. I'll be draping you again with. Alright, so you have been wonderful. Thank you for cooperating with me, and I'll just fix and clear everything up and do the aftercare of my materials. After that, I will be performing hand washing for my own personal hygiene. So now that I'm done with the perineal flush procedure, if there's any, I will be documenting for any pertinent observations that will provide us with any updates of the conditions or health concerns of our client. Now for the next procedure, I'll be inserting a urinary catheter to our female client. So urinary catheterization is a procedure where we insert a catheter through the urethra and into the bladder to drain or collect urine. This can be done right after or before surgery, or even for patients who have difficulties in urinating. So before I proceed, I'll have to check for the physician's order of urinary catheterization and for correct patient identification and correct procedure to be done. So before everything else, I'll be performing hand washing and prepare all necessary materials before proceeding to the procedure. So now that I'm done, I'll have to identify the client and explain the procedure to them to reduce their anxiety and for them to cooperate. So, hi, my name is Carl. I am a student nurse. May I know your full name, please? Alright, so when is your birthday? How old are you? Alright, so how do you want to call you? Alright, so Ms. Sotoro, as your doctor ordered, I'll be with you for your urinary catheterization, which involves a procedure of draining urine from your bladder. So for this procedure, I have to insert a urinary catheter through your urethra, and this will be a sensitive procedure, so I hope you can be comfortable with me doing this. Right, so you don't have to worry about other people seeing you. I'll make sure to close the curtains, and I already ensured that I locked the door, so other people won't see you here. Alright, now that I'm done, I'm going to assist you in a dorsal recumbent position, where you just have to lie on your back with your knees slightly flexed for a more comfortable position and for me to easily reach your genitals. So I'll only be exposing the part or the areas that I'm going to be working on and draping over the areas that I'm not to lessen your discomfort. So I'll just take my drop light for me to see the genitals clearly. So I already prepared my materials, so it's easier for me to locate them. Now I'll just have to arrange them in order of use. So I have here my catheterization set. Inside the tray it should have a sterile forceps, a pair of sterile gloves, cotton ball soaked in cleansing solution, a syringe with 10 cc of sterile water for inflating the balloon of the catheter later. And I also have my urine bag with me, so I'll be hanging this on the side of the bed where I can easily reach it to connect my catheter and collect urine. Alright, so I'll decontaminate my hands with an alcohol before donning a pair of working gloves to prevent cross-contamination and Alright, so I'll fully open the catheterization set now. Alright, so using my sterile forceps, I'll take one cotton ball soaked in cleansing solution. With betadine and cleanse the genital area. So the betadine will prevent catheter-associated urinary tract infection. So, Ms. Totoro, can I lift your drapes now? I'll take the perineal underpad. Alright. So from the mons pubis down to the anus. And discard. Then take another one and cleanse in a number 7 manner and discard. Another one on the opposite side. And then do the same thing again. I will be doffing my gloves and discard it in the receptacle. I'll just perform hand hygiene again. And then right after, I will be donning my sterile gloves already. So I still have to keep in mind the sterility of the area. So gloving our hands is important, and it doesn't replace hand hygiene. So I still have to wash my hands or perform hand hygiene before and after wearing gloves. Okay. So just adjust the gloves to fit right into my hand. Touch only the sterile areas and discard this in your receptacle. So I have here inside the tray of a catheterization set an eye sheet, and I will open this and cover the genital areas of the patient. So Ms. Satara, I'll be covering you with an eye sheet and only exposing the genital area. Okay. So as I am about to insert the catheter, I'll make sure first that it is well lubricated for easy insertion and reduced friction for the comfort of our client. So it has an outer package and an inner package. I'll be removing the inner package and discard it in the receptacle. Alright, so I'll pick up the catheter with my right hand 3 inches from the tip to allow the length for advancing the catheter, and with my other hand, I'll gently separate and pull off the labia minora for it to be stretched easily inserted with the catheter. So ma'am, I already instructed you of the procedure earlier. For now, can I touch your genital area? Alright, so I want you to relax as this might be uncomfortable with you. So when all these conditions are met, I can now proceed to inserting the catheter into the meatus for 2 to 3 inches or until the urine begins to flow, and make sure that the catheter is fully in the bladder and will not be easily removed since the female urethra is about 2 inches in length. Right, so that's about it. So if the doctor's order is only for urine collection, or a specimen is only to be collected, I'll pinch the catheter to prevent the urine flow while I prepare my specimen container to collect the urine. Alright, so to continue with the procedure, I'll rest my hand on the patient's pubis while holding the catheter in place to prevent pulling and pushing of the catheter. So I already placed my urine bag at the side of the bed, and this time I'll connect the catheter to the urine bag. So the urine bag will collect the urine that flows through the catheter. And then, once it's connected, I'll inflate the catheter using my pre-filled syringe. So the balloon will act as a hook to prevent the catheter from falling off from the patient's urethra. Right? If we're going to remove the catheter, then the balloon should be deflated by doing the opposite. So to secure the indwelling catheter, I'll use my tape to secure and stick the catheter on the patient's thigh. I'll make sure that it is not too tight to allow some slack on the tubing. This is important so the client won't accidentally muddle the tube while moving. Alright, so Ms. Altora, I'll be removing the eye sheet now. And then I'll be draping you again, covering you with your blanket. Alright, so then I'll just doff my sterile gloves and discarding receptacle. Alright, so you have been wonderful. I'll just assist you to a more comfortable position. And thank you for cooperating. So after the procedure, I'll just have to perform aftercare of the materials that I've used by fixing and clearing the workspace and perform hand hygiene as part of my personal hand hygiene. And if there's any, I will also document the amount of initial output, the color of urine, to be used as a data for diagnosis or for patient monitoring. So if there's nothing else, then I'll mark the procedure done.